Hello, good afternoon to you all. Hope you are enjoying the workshop. This presentation is made for first year trainees in surgery. This is not about surgical content as such, it is more of a philosophical talk. So sit back and enjoy. Any idea what this is? It is Milky Way galaxy, our home in the universe. Any idea how big it is? It is 1 lakh to 1,80,000 light years. You know what a light year means. Any idea how many stars like our sun are there in the Milky Way galaxy? 100 to 400 billion stars. Our sun is just one star amongst those 100 billion stars. So let us take the lower estimate of 100 billion stars. Any idea how many such galaxies are there in our universe? 100 billion. Any idea how long the universe has been in existence? 14 billion years. Billion is 1 followed by 9 zeros. In this grand scheme of things, what is your existence? You are just a fleeting phenomenon, not even a speck of dust. Is that correct? Really? How big the universe may be. You are unique in this universe. There's never going to be a person like you ever in this universe. You are unique. So the reason I put this slide is to give you the two sides of the same coin. If you look at the universe, you feel insignificant. Whereas if you keep looking at yourself, you become a megalomaniac. There are many paradoxes like this in our life. You need to balance these things. So do not compare either with the universe or someone else. Just be yourself and do the best that you can do to your patients. Now, this is the meaning of surgery from Cambridge Dictionary. Treatment of injuries or diseases in people or animals by cutting open the body or repairing the damaged part. It is derived from the Greek word kairos meaning hand and ergon means work. Essentially, it is handiwork. This is from one of my mentors. He used to say, surgery is very simple. All you have to do is cut along the dotted line and suture it back. But the difficult thing is to know where the dotted line is and when to cut and when not to cut. Are we different from other branches of medicine? What makes you think so? Yes, we are different because we are inflicting injury deliberately on the patients in the hope of making them better. Ours is a all or none phenomenon. Patient usually has only one chance of having the surgery done. And there is a window of opportunity while treating the disease. In surgery, the window of opportunity sometimes is very little. So if you take the example of a perforation peritonitis, if you don't intervene in time, the patient will get into sepsis. And even if you do surgery later on, it's not going to help the patient. So you need to act decisively and do not lose the window of opportunity. We need a much thorough knowledge of human body than any other specialty in medicine, barring perhaps the radiology. And if you go into specialties like neurosurgery or cardiac surgery, patient's life is literally in your hands for some period of time. Coming to the origin of surgery, as early as 10,000 BC, trepanation has been described in Egyptian papyrus, Eberus. People those days, they used to think evil spirits were lodged in the brains of mad people. So they used to do this to let out the evil spirits. Patient is cured one way or the other. Circumcision again was described by the Egyptians in 2400 to 3000 BC. Cutting for bladder stones was described in 200 BC. This is where our lithotomy position comes from. Now coming to the privileges and punishments, 10 shekels of silver equals to roughly 40,000 rupees these days. Now that's the punishment. This is not something that I made up. It is written on stone in Code of Hammurabi in ancient Babylonia. So do not crib if a patient shouts at you. Our forefathers had to endure a lot more grave things. Now coming to the history of surgery, the modern surgery started in the era of Renaissance. Some of the people that contributed to surgery is Leonardo da Vinci, the same person of Mona Lisa fame. He was a painter, sculptor, philosopher, anatomist, and did many things. Andreas Vesalius is the father of anatomy. He wrote the first textbook on anatomy. So you may recognize these things, the Vitruvian Man and the first textbook of anatomy. This is Ambrose Pare, French surgeon, who famously quoted, "I dressed your wound, God healed you," by which he meant it is the nature that heals. All that we can do is simply do the surgery. This is John Hunter, famous British surgeon, considered as the father of British surgery. He has done extensive anatomical dissections on both human beings and animals. He has something like 20,000 specimens to his credit, well preserved and archived in glass jars. Many of them were destroyed in World War II, but the remaining are preserved in the Hunterian Museum at the Royal College of Surgeons of England. There is a story behind these three skeletons. The one on the left is the normal human skeleton. The one in the middle is the dwarf, and the one on the right is a Irish giant. So those days, these people were shown in circuses as freaks because of their abnormal anatomical features. So John Hunter was very much interested in these sort of people as to why they had these anatomical abnormalities. So this Irish giant knew that John Hunter would come after him after his death. So he asked his pallbearers to bury him at sea in a lead coffin. But John Hunter is so enterprising that he bribed those people and got hold of the Irish giant's body and dissected. And here his skeleton is in the Hunterian Museum. John Hunter found that this chap had a very large sella turcica, denoting that there is a pituitary adenoma causing gigantism. Such was the enthusiasm and perseverance of our forefathers. William Morton, you may have known from the World Anesthesia Day, he's the father of anesthesia. And Lord Joseph Lister is the father of antisepsis. Now we have moved on to asepsis. You should know the difference between antisepsis and asepsis. These are the sort of pioneers who have paved way for the modern surgery. Without anesthesia, we cannot really do what we are doing these days. Christian Bernard is the person who has done first heart transplant, and Eric Muhe, a German surgeon who did first laparoscopic cholecystectomy in the year 1985. He presented his series of 94 cases in 1986, but he was not credited as the German Surgical Society did not approve of his work. Later in 1991, he was rightly given the honor of having done the first laparoscopic cholecystectomy. All this history that I mentioned is from this book by Professor Harold Ellis. The reason I show this is it sort of gives you a perspective as to what our ancestors used to do. Some of the surgeries that they did look barbaric to us. There's a mention of a below knee amputation, which was done in 30 seconds without anesthesia, with people holding the patient and surgeon swiftly doing the amputation and bandaging. All those things look barbaric to us. But what we are doing now may look barbaric to our successors. Even in our own living memory, when I was at your stage in career, there used to be at least 2 or 3 gastrojejunostomy and vagotomy surgeries every single theater list. After the advent of proton pump inhibitors in early 1990s, all these surgeries have gone out of the way. We do at the most 2 or 3 a year these days. So in future, if some proper gene therapy or targeted therapy comes for malignancy, our successors 50, 60 years down the line may say, our predecessors used to do mutilating surgeries for cancer. These are some of the instruments used by our forefathers. This is something what we are using now. And this is the future. That's the Da Vinci Rabo. Any idea what it is? It's a nanobot used in targeted drug delivery. As a surgeon, there are certain skills that you require. Any idea who said that? Sherlock Holmes. What is Sherlock Holmes doing in a surgery class? It is the art of deduction. Sherlock Holmes used to go to the crime scene and pick up small evidences from the crime scene left by the culprit. And from those small clues, he used to deduce how the crime was committed. So, if you want to be a good clinician, you have to keep your sense organs open. Patients give you a lot of clues. You have to take them from the history, see them while examining, and from those clues, you have to come to the correct diagnosis and treat the patient. Our forefathers used the sense of taste as well to diagnose diabetes. Now, we don't have to do that. This list of skill set is from the Royal College of Surgeons. So I will quickly run through it. You can pause and read slowly. Now, this list is rather exhausting, and don't be daunted that it is such a big list. The most important ones are highlighted in red. Hard work, perseverance. These are the most important things. You should have a doggedness and keep pursuing things. Never give up. And this again is in relation to what Ambrose Bierce said. Faced by a patient who has lost the power to heal, the most famous surgeons are reduced to impotence. So how great surgeon you may become, if the patient doesn't have the ability to heal, all your efforts will be of waste. Know your limitations, both personal and professional. Never try to do everything on your own, and call for help as and when necessary. You need to have empathy, good communication skills, leadership skills. You have to present, publish, coping. It is the emotional resilience and ability to support yourself and your team in sometimes difficult situations. These are some of the thoughts that may come to your mind while doing a difficult operation. Why did I get involved in this operation? Next. 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 Now, believe me, these thoughts definitely go through your mind, especially something like you're doing a anterior resection or AP resection, and there is a lot of bleeding from the pelvic plexus. You're not able to control the bleeding, and the anesthetist is shouting that there's no blood available, and the patient is getting into bradycardia. These are the things that can go through your mind. This is not something that I have made up. It is from this book. If you have time, read it. So you need some form of stress busters. Always have some me time. Keep some time for yourself. Have some hobbies. De-stress yourself. Have some exercise for the body. Some form of meditation or relaxation for the mind. You are perhaps too young for serious spirituality. But let me just say, whatever names the religious texts may give to the divine force, there is one divine force that permeates the entire universe. So if you do whatever work that you do as an offering to the divine and accept everything that you get in return, whether it is good or bad, you will have less stress. That doesn't mean you stop doing things. You must do things very diligently and to the best of your efforts. But do not worry about what you get in return. Never rely on intoxicants for relaxation. For you to be a good surgeon, you must be a good assistant. What do I mean by being a good assistant? For you to be a good assistant, you should know what surgery is being done, what are the steps, what is next step. So you participate in the surgery in such a way that it becomes like a synchronized swimming between the surgeon and the assistant. So if you have that sort of knowledge and proficiency, it is quite natural for you to progress to be a good surgeon. Even if it is a small surgery, never feel shy that I'm doing a small surgery. It's basically dissection skills, good hand-eye coordination skills, and suturing skills. So even a big operation is a series of small operations if we divide it into multiple steps. So you have to be thorough with each and every step. You have to be fair and honest in all your dealings. You have to be fair with your patients. As Professor Harold Ellis used to say, put yourself in the patient's shoes and advise the treatment you yourself would have in that situation. Nowadays, with having so many variety of treatments for any disease, sometimes it becomes difficult which treatment to advise to a patient. Now, if you use this rule, the decision making sometimes becomes easy. Now, you have to be fair with the hospital and management. You have to be fair with your colleagues and staff, your family, friends, and above all, yourself. Now, here the paradox. If you are too fair to all the above people, you are not being fair to yourself. If you are too fair to yourself, you are not being fair to others. So you have to balance things. How many of you have heard of this gentleman? He is a American surgeon of Indian origin. He is a colorectal surgeon based in the northeast of United States. He is the person who is behind the WHO surgical safety checklist. So if you find time, read his books. He's written some 4 or 5 books, quite good reads. Always pursue excellence. Never say that doing a sebaceous cyst or something like that is a menial job. Do that to perfection. Now, for you to pursue excellence, you have to create healthy habits. Try to make excellence a habit, and excellence will get you the recognition. This is a book about how you can make small habits as a routine and how it will change your life. Now, this is your position in the world. I put 30,000 per month as income, which you all must be getting as a stipend. That puts you ahead of 92% of the world population. You can check it for yourself. So that means you are ahead of 92% of the world population just by virtue of being what you are. So don't crib that I don't have this, I don't have that, somebody has a bigger car, all these things. So just in your own life, look at people, your school mates who could not join medicine, or your medical school classmates who could not get into surgery, who wanted to get into surgery but who could not get into surgery, or even any post-graduation. So compared to them, you are a lot better. So again, the paradoxes in life here. If you are too happy with what you have, you will never progress in life. If you are not happy with what you have, you will never be happy no matter what you have. So keep that thing in perspective, count your blessings, and try to get even better. Help others as much as you can. When I say help others, it doesn't necessarily mean money. It can simply be spending some time with your friend if he or she is going through a bad period, or helping a junior in understanding some concepts in surgery. Anything, it can be anything. By helping others, I want you to experience the joy of giving. Again, giving doesn't mean money, it can be anything. While going in a car, scorching heat, give way to the pedestrians or a cyclist on the road. It can be anything, any act of random kindness. Whatever you do with good intention will always be reciprocated to you in return by the universe. There is a catch here. Always give without expecting anything in return, even a thank you from the receiver. You should be humble in giving. Give wholeheartedly whatever you have to give. Be glad that you are in a position to give, and be thankful to the receiver for having received what you have to give. Never expect anything in return. Then you will enjoy the joy of giving. Now, this is Sir Robert Hutchinson, the same person of Hutchinson's clinical methods. Now, this is what he had to say. Holds good even today. Now, essentially, all of you may not become the best surgeons, but every one of you can become a good surgeon. In conclusion, what we need is balanced and holistic surgeons. Sometimes you have to be trigger happy and ready to jump and do an operation in an emergency situation. Sometimes you have to be an autocrat to lead the team and keep the patients and their attenders in control. You have to be like a businessman. You should not allow the patients or management to exploit you. You should be kind. On the whole, you have to balance your life in general and profession on all aspects. Thank you all so much for being here. Hope you enjoyed the talk and you are enjoying the workshop. Hope to see you all one day in person. If you have any doubts or need any clarifications, you are always welcome to either message me on WhatsApp or send the email. All the best. Take care.